Hello, everyone. So here we have today Dr. Bevin John Jacob, who has scored 161 in the recently conducted Jan 25 FMGE exam. Heartiest congratulations, Dr. Bevin.
Thank you so much, man. It's my pleasure.
Thank you. Thank you so much. So, Dr. Bevin, before we start, actually getting some insights from you regarding FMG exam preparation, who would you like to credit your success to?
Uh, uh, to be honest, it has been uh, the mixture of everyone I had watched, and your role has been pivotal also, ma'am, because the way you have integrated the questions, all the way you have made it in a tabular form and made it look so concise and precise. It was just, I would say, it was mind blowing for me to actually understand the fact that you actually did make it. I mean, it takes a lot of effort, ma'am. I mean, looking from the other side as a student, we might feel like it has came out in an understandable way, but I really appreciate the efforts you have put into making that, and really thankful to it.
Thank you so much, Dr. Bevin. That's really kind of you.
Thank
And
you.
yeah, we would also like to know that where have you graduated from and what attempt was this?
Yeah, actually, I graduated from Wuhan University School of Medicine. So this is my second attempt. The previous attempt, my score came around 147.
Oh,
Yeah.
just 3 marks short.
Yes, yes, exactly.
Right. So, I mean, since you mentioned you had scored a 147, and I'm
Hmm.
pretty sure it must have been very disheartening at that time, just that 3 marks.
Definitely, ma'am. Yes.
And there are so many students this time as well, who are on this between 145 and 149. So,
Yes.
what would be your message to them? Like, how did you cope up with that? And what would be your message to those students?
Um, First and foremost, I think I would like to say about failure. Actually, it is integral actually for us to bounce back. Until we actually have something of sort of lacking, or like in the world's eyes, it might feel like a failure, but actually it's just a setup for a comeback. I feel it that way. Yeah, because honestly, ma'am, I wouldn't say that it was an easy journey. It was really hard. There were a lot of hardships which I had to go through during the process, but it was worth it. It wasn't easy, but it was worth it, ma'am.
Yeah,
Because
like
and
you said
yeah,
that everything which is worthy is not easy, right?
exactly, ma'am. Absolutely.
All right. So Dr. Bevin, we would also, like to know that how did you restart your journey after the previous attempt? What was your approach on, clearing the exam this time?
Okay. Uh, for a few weeks, I was not feeling well because of the results, and I felt really bad, and I doubted myself. And then I understood that I can't be, sunk deep into that emotion for a longer period because I'll be wasting my days. Then, then I actually tried to understand my mistakes, where I actually lacked, and then I tried to correct it from the grassroots level. And slowly, I understood the areas where I was lacking, and that's how actually is the business, is the X and the.
Okay. So when you analyzed your mistakes in the previous attempt, what did it boil down to?
Ma'am, I used to make a lot of silly mistakes, like the questions which actually I really did know well conceptually, but it always came down to two questions, or I mean two options where the confusion will be there. I would I would say most of the students also will agree on this fact, because always in the exams also there'll be two options which will be confusing and looks somewhat the answer for the act. But we actually have to mark the most appropriate answer on the day of exam, right? So that actually was the thing which I had to cut off. And for that, I started doing more of questions on a daily basis. And it really helped. It came out well.
Okay, that's
Yeah,
great. So basically, more of MCQ practice is what you focused in this attempt.
exactly. Yes.
All right. And coming to you've been a Medsynapse app subscriber. So we would also like to know that, how did you get to know about Medsynapse app by Dr. Nikita, and how useful was it in your journey?
Ma'am, I came to know about your Medsynapse through my seniors who actually had cleared the previous time, and they actually told about how conceptually and concise your materials had been. So, and once I actually got to see your videos in YouTube, I couldn't agree more with what they said, and then I really gave it my go for that.
Okay.
Yeah,
And so I'm glad to know that. I hope you will pass on the same message to your juniors as well, right?
definitely, ma'am, definitely. You're more than just I won't say it's just that word inspiration is would be like small because I don't know, ma'am, how I can articulate it or whether I'll be able to articulate it well. But all the small, tiny errors we might make on the day of exam was actually properly told by you, ma'am, because
Thank
that helped me a lot on the day of exam.
Thank you. Thank you so much. And
You're welcome.
so basically, I would like to know that, how did you approach the content that we had on the Medsynapse app? Like we had short, extra edge, then we had MCQ discussions. So how was your approach on that?
Ma'am, the short questions were the ones which I focused mainly on, and those videos really did pave my way to understanding the grassroots level concepts, and it really helped me to integrate a lot of subject. So yeah, that was the one thing which I focused mostly on, man. The
Okay.
short videos, it's top notch, man. I
Thank
would
you.
suggest anyone to subscribe to your Medsynapse, man, because it's just so concise. I would say to anyone that it's just perfect.
So if anybody is just, let's say for FMD student who's just relying, let's say on Medsynapse app, do you think it's going to be enough, or you need to complement with the primary resource?
Um, it's a personal choice, ma'am. For each person, the journey will be different. But then, if you have the adequate amount of knowledge previously, if you're a second timer or third timer, then I would say your resource will be enough. But
Okay.
for those who actually want to supplement or feel like this is not enough, they can opt other also. But for me, yours was more than enough actually, because you had everything in just that application for the preparation. So it was really great to actually subscribe to Medsynapse, ma'am, because each and everything when it comes to the mnemonics, ma'am, it's just top notch. I'm not saying anything like in a flattering manner, but it's just I don't know how to articulate it, because this journey wouldn't have been possible without your help, man. So I really dedicate also this win to you, man.
Thank you so much. Right, I'm sure that to the
Mm.
viewers it might seem like this is a lot of flattering happening here, but guys, I mean,
No,
this
guys,
is just
this is the
honest.
truth. This is the actual truth. Nikita ma'am is an inspiration, guys.
Thank you so much. So, we would also like to know that, how many mock tests or GTs did you give in your preparation, and how did your scores improve? How did you review the GTs? So, all about how many mock tests to be given and how to review them and improvise on them.
Okay, ma'am. The GTs I actually gave 4 GTs,
Okay.
and while doing GTs, I actually focused more on the parts where on the questions which I made wrong, and then I corrected those mistakes, because those are the times when we get time to properly analyze, because on the day of exam we can't make that mistake, or we can't, it's too costly also now. So I made sure that I correct those mistakes, and I won't make that mistakes on the day of exam. So it really helped me. Doing mock really helped me, because actually the mock, when you do the mock, it's just like doing any other exam, but the actual mock starts when you start analyzing it. That's when you really understand which is your strong area and then the weaker area, like that.
Okay. And did you give mock exams like from one platform or multiple platforms?
Multiple platforms.
Okay, multiple
Yeah,
platforms. Like personally, even I believe that giving mocks from multiple platforms is actually good because you get to see the variety of questions rather than just, the
definitely,
biggest
ma'am.
pattern of
Yes,
questions.
ma'am. Yes.
All right. And if I talk about, the top three scoring subjects, if I ask about in FMG exam, what would be your top three scoring subjects?
Ma'am, top two scoring subjects I feel are surgery, OBG, and medicine for sure. Those three, you can't afford to leave on the day of exam because those questions on the second in the second paper mostly come from that, and integrated also medicine which will be integrated. So yeah, you can't leave medicine either. So the three subjects I will say is surgery, OB, and medicine. Surgery will be a kind of twisty and all, but you still can crack it if you know that basic concepts in surgery.
Okay, right.
Yes, ma'am.
And the Medsynapse app helped you basically only with the mnemonics, or did it help you also to build the concepts?
Both ways, ma'am, the mnemonics and the concepts. Because I still remember the mnemonic for the graph in pharmacology, that help mnemonic which you have
Yeah,
made. And that really did help me. On the day of exam, there was a question also, and it reminded me of you. And I was happy that I got a question which through your mnemonic also.
right. I mean, the mnemonics
Yes,
actually help in effortless recall during the exam.
exactly, ma'am. It's mnemonics are the best.
Yeah,
Yeah,
mnemonics as we call them. All right,
yeah,
thanks. And the next thing that we want to ask is, part A versus part B in the FMG exam. That's your preclinical
yeah.
clinical subjects. And, how was your part A? And on the day of exam, if the part A does not go well, how should a
Mm.
student basically, stop thinking about part A and focus on the part B? Because you have a good amount of time gap between the two parts.
Yes, yes. Ma'am, the part one was pretty much an average paper for me. I it was like 50-50 because I was a bit confused with the options I marked and all. So then, but I made sure that that shouldn't get into my head also because I have to focus on the second paper because the two papers marks together becomes the passing score, right? So I mean, plus 75 each also you'll get 150 still. So I made sure that my mind is clear and I shouldn't get things which are negative into my head because that particular day decides our future also. No? So I was particular about that also, ma'am. And I feel um, this day of exam is the most crucial day where you have to feel like you did your best and you have to go out there and try to recall how much ever you have studied. It's okay. Some questions will be tricky and you feel like, oh, I can't recall it. But it's about those questions which you really know and partially know. Try to crack those questions and yield the most out of this.
Very
That's
true.
what I focus, man.
Very true. I think
Yeah.
students need to understand that, to crack FMG exam, you don't need to know answer to all 300 questions, right? 150 out of
Exactly.
300 also helps you to clear the exam,
Yeah.
right? So do not get panicked in the exam hall when you're not
Yes.
able to answer the questions. It's really, really important.
Yes.
Right.
Also, ma'am, I would like to add one more thing, ma'am, because on the day of exam, however well we prepared, also our mindset really matters, ma'am. Because those questions which we don't know, sometimes we waste a lot of time on those because the timer, the actual villain is the timer. So we have to, prioritize whether we know the answer to this question rather than wasting so much time on the question and waste and not getting proper time for this question we actually know. So I feel that also should be corrected if we are going for the exam prior.
Yeah.
Yeah,
So time management is very, very important.
yes, ma'am, exactly.
Okay, great. And I'm pretty sure that during the preparation, you might have also faced days when you are not feeling like studying, or you're feeling like I'm forgetting everything that I'm studying, right? So,
Yeah,
how you used to cope up with that?
ma'am, that is actually a true thing which I would like to be honest and answer, ma'am, because there were days like you I have asked, which actually I couldn't give my best output because those days actually define who we are because the amount of struggle we might go through during that preparation in an individual way will be different. But those days actually really matter, because those days how we pick ourselves up and say that you can take a break if you want, if you feel burned out, and then start preparation again. But it shouldn't be too much also. Like, the border should be there, that
Yeah.
basically if I'm taking a break for one day, the next day I will make my hours more into my studies, like that. Yeah,
All right.
it's like a mixed journey, but just like I had said earlier, ma'am, it's not easy, but it's always worth it.
Yeah, very true. Very
Same,
true.
yeah, sir.
So did you have anything like, any motivational quote or any book or any videos that you take recourse to basically to get out of this?
Yes, ma'am. Definitely there's one. I would say this has most of it, I feel personally, I believe, because the quote goes like, weak men find excuses, strong men find solution.
Oh, that's
So it's up to us to decide
yes.
whether we are what. Yeah,
Yeah. A winner always focuses on the solution and not on the excuses.
exactly.
I mean, that's great.
Yeah.
So suppose now if I ask you about the students who are going to prepare for FMG June 25, right?
Mm.
And we are here like almost in February starting. So if you can tell us, how should be the approach for a student who's preparing for June 25 exam?
Um, for the June 2025 exam, the days might look a bit short, but it's all about knowing the basics concepts for the students who are preparing for it. Because once we are thorough with the concepts, it doesn't matter how much time it takes, it's okay. But if you're not thorough with the concept, it's like you're not set with the foundation, so you can't build up. So the foundation should always be strong. So how much time are you investing? Invest on the basic subjects, then go on with the bigger subjects like surgery, medicine, and gynae, so that you can integrate as well. So
Right.
it'll be worth it.
Right. So basically, how should be the approach? Like, let's say there are 5 months. So how much time should be given for the first read? Then how many revisions, duration? How should it go? The 5 months timeline.
Yeah. So basically, personally, I actually focused on giving, um, a month or two was my target for the basic subjects like physio, biochem, pharma, patho, and all, anatomy. So these five subjects are actually, it might look like it's really hard to understand in the first go, but slowly you'll understand once you know all those. The bigger subject becomes a bit more simpler and pretty much integratable.
Okay.
Yeah.
Right.
And so I will say, also the subjects like surgery, if you can integrate and study. Like one day, if you're studying physiology, start studying medicine, that portion which is related to it. So then you don't feel like we won't feel like actually we did study. I mean, it won't even give us a thought like we are studying all the 19 subjects. It just feels like we are studying one topic and we are integrating with a higher medicine topic, like that.
Okay. Okay. So
Yeah,
basically, like physio, patho, pharmac, medicine, if somebody's doing cardiology, like entire thing can be integrated together and it can be studied in that way.
exactly. Just like that. Yeah.
Okay, okay. And the most common query that we also face is how to prepare the material, what is to be revised in the last 1 week or last 10 days before the exam. So, what was
Mm.
your approach? What did you do in the last 10 days or last week?
Ma'am, to be honest, I was panicking a lot towards the last 10 days, because I knew a lot of things, and things are up in my head, and but then I wasn't able to revise much subjects, because the plan was there. I was trying to go with the plan of focusing on the high yield subjects. So then, that's when I actually understood the fact that it's just the feeling which we all will have along the journey, that that journey, that feeling, that tiny feeling, that will I be able to make it, or will I be able to do it, those kind of things. those actually comes, and it is quite normal. It comes to everyone who has studied a lot. So that time you just have to tell yourself that you did your level best in this particular months of the along the journey, and just focus on what is controllable right now. Ma'am, I believe I'm a huge follower of what MS Dhoni says, ma'am, because he's a true leader actually. Because I have heard his interviews and I'm got inspired from what he says. Because there are a lot of things if we actually decide to control, we actually get to control it. Like it's all up in your mind, man. Everything is possible if we are able to control our mind. We can achieve a lot because it's the controllable that matter. If we worry about the results, we can't actually focus on the controllables which are right now in our hands. So it's the result actually I feel is a reward which God gives for our hard work and dedication. So it's as simple as that, man. Because the small things are the ones which actually really matters during the preparation days. And yeah, to what you asked, ma'am, I really went afar.
No, no
So
worries. Yeah.
yeah, so ma'am, yeah, exactly what I said about MSD is the thing which I actually tried to do also, ma'am. At that point, I tried to focus on the controllables, ma'am. Those things which are like those subjects which I'm really strong at. I studied to, I tried my level best to revise those subjects. For me, ma'am, pharmacology has been my strong subjects. But on the day of coming to the day of exam, I really felt like I'm forgetting all those mechanisms, all this, everything. Like then I went back to the videos of yours. It really helped me, and I watched it. Then I was fine. Then I felt good. Okay, I know it now. Then now I'm good to go. Then
That's
ma'am,
pharmacology is
patho.
my favorite as well.
Yes, ma'am. Thanks. Yours favorite also is it?
Yeah, yeah, yeah. So you must have
Oh,
seen
all
so
right.
many mnemonics and pharmacology that we have. Right.
Yeah,
That
good to hear
tells
that,
how
ma'am.
much I love the subject.
Okay. So yeah, ma'am. So the journey, as I said, is rewarding and worth it. So those last 10 days, my plan was to focus on the subjects. The 10 subjects I gave it like, and then I understood if certain subjects, if I'm not understanding or I am feel like I'm forgetting it, I actually did questions from those particular topics. So that actually did help me.
Okay, okay,
Yeah.
all right. So Dr. Bevin, I mean, we had some great insights from you regarding your journey and the tips for the upcoming next batch as well. I mean, thank
Yes.
you so much for all of that. And we wish you all the best for all your future endeavors as well. And
Thank you so much, ma'am.
hoping to see you back with another interview after your NEET PG exam as well.
Oh, sure, ma'am. I would like to subscribe to yours only for NEET PG also, ma'am.
Definitely.
Definitely.
I mean, we are going to be in that journey as well together, and we are going to crack it together.
Thank you so much for all the efforts, ma'am. Really means a lot for the efforts you have put into it.
Thank you. Thank
And
you, Dr.
and my pleasure having this interview with you, ma'am.
Right.
God
My,
bless you.
my pleasure. Thank you so much. Thank you so much, Dr. Bevin. It was great having
Thank
you
you, ma'am.
here. And again,
Okay.
all the best. Thank you.
Thank you, ma'am.